Welcome for those of you joining us. This is how to ace the Class 2 section of your boards utilizing the Compositite 3D Fusion Student Board Kit. This is a kit that we have specially prepared. It's kind of a cut down version of some of our larger retail kits to give you, the student, enough materials to practice a few times and then be ready to roll on your boards. It also has a combination of materials in here that some of our other kits don't have because they are particularly beneficial. These materials are particularly beneficial for students. What we're going to do, just to give you a brief rundown here this evening, is I'll introduce myself. I would like to tell you a little bit about some other educational opportunities that we have available for you. Then we're going to take a detailed look at what is in the kit, and then we're going to use it on a typodont, just like you will be doing for your exam. So we'll walk through what the different pieces are, and then we'll put them to work. And we should have plenty of time at the end for some Q&A. So without any further ado, we're going to go ahead and get started here. My name is Kevin Wahlberg. I've been here with Garrison Dental Solutions for a little over 19 years. It's been a great opportunity. I was the third employee that they hired here way back when. Now we've got offices in a couple of countries and all sorts of people and new products and everything, and so it's been really fun to work here. And it's given me the opportunity to travel around, meet with literally thousands of dentists all over the world, and explain our products, learn how clinicians are using our products in everyday practice. So it's been a great learning opportunity. So my email address is there on your screen. If you have questions or concerns throughout the evening, please feel free to go ahead and send me an email. So tonight is not a CE event, and we will be posting the recording of tonight's event in a day or two out on our YouTube channel. So if you go to YouTube and you search Garrison Dental Solutions, you'll see our YouTube channel and can jump on that. So some of the other opportunities that we have, if you go out to our website, garrisondental.com, and there's a little tab that says Learning Center. You open that up, and then there's another tab that says CE and Webinars. We've got links to upcoming events that you can register for. Many of them are free or very low cost, and also links to the different recordings that we have out there on YouTube. So it's a great resource if you want to take a look at some more detailed information. We can also, this is kind of a fun thing that we can do, if you have a group of students at your school and you want to get together and have a live Q&A, live video demo of the different products, anything like that, we're happy to accommodate that. All you have to do is send me an email and we'll get something like that set up for you. There's no cost for that, of course, and we can do those really pretty much any time that is convenient for your group. We also have Bruce is our university liaison, and he travels around the country speaking to student groups, faculty members, and so forth. We're very active in the different schools around the country. Many of the schools carry our product and teach our product in the classroom. So if you want to schedule a lunch and learn opportunity at your school, I would encourage you to email Bruce. That is a limited availability. He generally will try to schedule something where he's going to an area and meeting with a couple schools, in the surrounding states and so forth. So it's he'll make a circuit. So just got to get on his schedule for that. This is exactly how a student board kit would come to you in the green Fusion box. It's got a set of user instructions with it, and we're just kind of doing a little unboxing here. This is of course, the kit itself. and then the ring placement forceps. Now, here's your first tip of the night is you probably have a pair of rubber dam clamp forceps that you purchased with all of your supplies for school. That is not a good item to use for placement of the sectional matrix rings. We'll show you a little more detail on that in just a couple minutes, but it just doesn't work very well to control the ring or separate the ring properly when you're placing it. So use the ones that came with your kit. So let's pop this open. We've got all kinds of fun things in here. So a sectional matrix system is generally comprised of three basic components. You've got the separator, retainer rings, the sectional matrix bands, and a wedge. This kit also includes, when I show you these, you're going to love them, it's fender wedge, which is a great product that can well, frankly, it can save you a couple points on your board exam, and we'll go over how to make the best use of that. So, in the kit, there's a variety of materials as far as sizes go. So let's take a look first at the rings that are in the kit, and I'm going to slide that out of the way, and then we'll zoom in here a little closer so that we can see some detail on these small little parts. Okay, so this is the deluxe kit. It has all three of our separator rings in it. There are, well, particularly when you're doing the test, you're probably going to be doing a pretty basic MO or a DO, which means you'll be using the blue or the orange ring. The difference between these rings is, get that stabilized here a bit, you can see that the orange ring, the tip is quite a bit taller than the blue ring. And for just an MO or a DO, it doesn't really matter which one of these two rings you use. However, if you're doing an MOD, you're going to use both of them at the same time. And you're going to put the blue ring on the mesial of the mesial restoration and the orange ring on the distal, so that you've got them stacked one over top of the other. So, but again, the restoration, we're doing just a little MO here tonight, and that it really doesn't matter which one of these two rings that you use. One of the great things about this fusion system, we introduced it last year. I think it's our 7th system that we've introduced over the years, and we've gotten pretty darn good at this. We've got some really great features here. This portion of the ring, the blue here, is a soft silicone, and that allows the ring to adapt very, very well to the tooth. Really cuts down on the buccal and lingual flash, saves you a lot of time and cleanup. You'll see here on the tip, this plastic wraps around and creates a retentive barb, and that grips down below the infrabulge of the tooth and helps prevent that ring from popping up off the tooth. So these hold on really, really well. Some other rings that you might see out there that have plastic tips, they don't have this retentive barb, and you have to be very cautious when you place them that they stay, don't come popping up off the tooth. The underside, this is the side of the ring that would go towards the gingiva, is slotted out to fit over top of the wedge. So that gives you your perfect clue. When you place this ring, this should be down towards the gingiva. You should see the garrison up on top. So, in fact, it's virtually impossible to place them upside down. However, I have seen people try to do that by accident. So that's why I'm taking a few extra steps here to point out some things that might seem obvious, but sometimes they're not. So now the green ring that comes in the kit is for really wide preps. You see how much wider the tip of that is compared to the blue. So what that does is it allows the tip of the ring to bridge that missing cusp, whether it's on the lingual or the buckle, and prevent the ring itself from collapsing the band into the restoration. So you still get nice separation from the ring, you still get a great shape, shaping that band to the tooth, preventing flash, but yet for those really wide boxes it doesn't collapse in. Still has the retentive prongs on the bottom, so it's a great product. This has been extremely popular. You'll use this more in clinic than you would necessarily on your board exam, because you probably won't be doing this restoration on your board exam, but boy, that's going to be nice when you're in clinic. So those are the rings. The kit has 3 sizes of the matrix bands, so let's take a look at those. Now the sizes that come in the kit are the 3 that do not have subgingival extensions on them. Not a product that you're probably going to use frequently in the type of work that you're doing, so they're not included in this kit. They are available, and certainly once you've graduated and you're out and about, you may want to pick up some of those extra deep bands, so that if you run into those really deep preps, you're ready for them. But the 3 sizes, you've got your basic standard molar size, you've got the purple, which is a 5.5 millimeter medium size, and then a bicuspid premolar size. I say bicuspid and premolar, however, the thing to keep in mind when you're selecting a matrix band, you want to pick the band that most closely approximates the height of the tooth. You don't want a band that's too tall or too short. If it's too short, you may fill over top of that marginal ridge area of the band and cure the band into place. So you don't want to do that, obviously. And if it's too tall, your interproximal curvature is going to be a little bit flat, and the tendency is going to be to overfill that. And of course then you've got to come back in and carve that all down, usually with rotary instrumentation and so forth, and you're going to end up with kind of a squared off marginal ridge area instead of a nice contour there. So pick the band that most closely approximates the height of the tooth. The tabs on the band can be used for placement, and so that is always going to be your marginal ridge or your margin side. The opposite side goes down towards the gingiva. And the color on here is actually a non-stick coating. Helps prevent the bonding agents and the composites from sticking to the band, so when your restoration is complete, they're a lot easier to get out. So those are the bands that come in this particular kit. Then of course there are wedges. These are the compositite fusion wedges, and you notice that they're very different than your typical wood wedge. These are a firm plastic core with a soft rubbery outer body. These little fringes on here, these fins, are soft rubber. I don't know if I can get much closer here without losing focus, but as you can see, well, that's losing a little focus. You can see how they flex there. There we go. So as you insert a fusion wedge, the little fins bend back, allows the wedge to slide through that interproximal area, and then prevent it from backing out. A typical plastic wedge, that's a concern that they will back out on you. The fusion wedges don't do that. And with this, the fins add a lot of adaptability to the wedge. So if you've got a concavity down towards the gingival, like you get on some of the molars, that is going to flex into that concavity and help seal that matrix band against the tooth. And of course, that is critical with these bonding procedures, that you've got that box sealed very nicely so you don't get any fluid seepage in there. That helps you prevent overhangs and flash, particularly down right at that gingival margin. So, getting a good seal is critical. 4 different sizes. frankly, the ones that you're going to use the most are going to be the blue and the orange. The yellow is very tiny. And this guy, you know, well, I would suppose on an older patient, maybe with a little recession or teeth that are a little more mobile, you're going to want to use, you know, step up to the green. There's really no key indicator what wedge you're going to need. That just comes with experience. You know, I can caution you by saying that, you know, if that wedge feels a little too loose, hey, go for a bigger size, because the last thing you want is the matrix band not being secured in position and not being sealed properly. So don't be shy about wedging. And then the last part in this kit, excuse my arm jumping in the frame here, are the fender wedges. And the fender wedges are used when you're preparing the tooth. And this is what can really save a grade here on your test, is this metal shield will absolutely prevent that burr from nicking the adjacent tooth. And that is a real lifesaver. So one of the keys here, the different colors are different sizes of the wedge portion. You see how the yellow is quite thick, the green is thinner. I don't know which one of these. I think the purple is probably the thinnest. Let me grab that. Yeah, purple is really thin. So if you compare the purple to the yellow, there, you can see how much thicker the yellow is. And that's very, very important. What you want when you insert the fender wedge into position, you want the wedge portion to be what is holding that in place. If you use a purple and that interproximal space is really small, it's going to feel tight because the metal shield is going to be pushing interproximally, so it's going to feel like it's tight. But if you break contact with your rotary instrument and the shield was all that was holding it into position, you can actually have your rotary instrument flick this thing right out. So you want the wedge portion to be what is securing the fender wedge in position, and that will prevent that from happening. So, all right, so we've looked at the different components here. So let's look at, I want to grab the ring placement forceps here. Now again, as I was saying, rubber dam clamp forceps are not recommended because rubber dam clamp forceps don't have anything to hold the rings. Here, let me get this down a little bit. There we go. So you can see the curved hooks in the end of this forceps are for engaging the tines or the body of this ring to hold it securely. You grip it right behind the tips here, right where this makes this bend. You don't want to grab it on the plastic. You could break the plastic there, and it's also much harder to open when you do that. So getting it up here right behind the tips, right on the wire portion, that wire engages nicely down into those grooves, gives you great control. This doesn't want to wiggle on that forceps and gives you the ability to control how you're placing the ring, which is very, very important. So don't use your rubber dam clamp forceps. So let's take a look at a case here. You're pretty familiar with this patient, right? So basic MO, we've got, what do we got, a lower? Yeah, lower. And when you first take a look at the restoration or after you've prepped the tooth, it is going to be beneficial, make it easier for you to place the matrix band if you've broken contact with your prep. And of course, you don't have to worry about hitting that adjacent tooth because you'll have a fender wedge in place. So, in fact, that one's a little too loose. I'm gonna grab the yellow one for this because this is pretty wide open here. So again, you want that wedge portion, the yellow wedge portion, to be firmly holding that in place as you're prepping. And then you can get right in there, do everything you need. You don't even have to worry about that adjacent tooth. And of course, if you nick that, mark that, now you gotta polish that up and hope that they don't see that you hit the adjacent tooth. So it just eliminates the worry. It's such a nice, simple product. So place that in there while you're prepping a tooth. Now on a live patient, not only does this prevent that inadvertent damage to the adjacent tooth, it helps to start the tooth separating process. As you've got this firmly seated in here, it's stretching those ligaments out, allowing those teeth to separate. It will make placement of the matrix band easier. So let's just go ahead and slide this out because we've prepped our tooth now. This particular patient, I think we want the green band for this molar. It's fairly tall tooth, so what I'm going to do is I'm going to grab the matrix band by the tab. I'm going to just kind of bend the tab over a little bit so I've got a nice angle. Now when you're placing a matrix band, they're tender, they're 15 10,000ths dead soft stainless steel, so if they catch on anything and you put pressure on them, you're going to distort the shape of the band. So you want to, the bottom edge is quite sharp, so it can catch the edge of the prep. So it's difficult to come in and try to push this straight down without catching on the sides of the prep. So if you kind of start it a little bit and roll it into position, there we go. You can feel when that band is catching, and as soon as you feel that, if you put pressure on it, you're going to distort the band. So just shift it around a little bit until you don't feel that catch anymore. So then make sure it's seated down gingivally all the way. So this particular patient on that tooth is going to use a orange wedge. I've worked on this guy quite a few times. Wedging, if your prep tends towards the lingual, wedge from the lingual. If it tends towards the buccal, wedge from the buccal. And that's going to allow the widest portion of the wedge to be engaging that band where it needs to, if it's tilted a little more buccal or lingual. This one is pretty straight, so it really doesn't matter which size you wedge from. This is very important with the sectional matrix system. You need to hold a finger firmly on that band as you're wedging. If you don't hold the band firmly, you're going to push the band right out with the wedge. In fact, here, let's go ahead and do it. There. See how that just tilted it up? Popped the band right out of position when I put that wedge into place without holding it. So hold that thing down, then wedge it. Wedge fairly firmly. So once your wedge is in place, you can just push these ends of the band tighter up against the tooth to get them out of the way a little bit so that they don't interfere with your ring placement. And then again, we're going to grip that ring right by the tines. And what I'm going to do, let me tip it up here a little bit, is kind of similar to the band. I'm not going to come straight over and try to push it straight down, because the width of that, you can see top down, the width of that is such that I'm going to grab the edges of that band, and as soon as I put force towards the gingiva, I'm going to crush the band with the ring. So what I want to do is I want to come in at an angle, and I want to open it up and come from in front of it into that band. So I'm going to come from in front into the band. Oh, we caught there. There we go. So that I'm not pushing the band and crushing it down. So, and then once you've got it in the interproximal space, you can rotate it around and then seat it as far gingivally as it will go. So that will get these That'll get that little white tip that we talked about earlier. That'll get that right down below that infrabulge nicely so that this ring cannot pop off. So now we've got our ring in place, and you can see, you can see how nicely that silicone on the tip adapts that band right to the tooth. So there's just no chance for buccal or lingual flash there, and that's the beauty of those silicone tips. They just do a fantastic job. Now, before you start your bonding procedure, you're not done with this yet. You need to come in and just tug that band over against the adjacent tooth. You want to make sure it's in firm contact, and then use your magnification, use your mirror, whatever you need to, and preferably Explorer. I don't happen to have one here, but an Explorer, and just feel down in there and make sure, I think you can see, if I can get the light on that nicely, that this band is just in nice intimate contact with the tooth, right down by the floor of that box. You can't see any gap in there, and that's really important. If you can see, a black line, like there's a gap in there, or heaven forbid, you actually see the wedge down between there, obviously you don't have a seal then, and you don't want to proceed. You want to take the ring off, take the band out, start over again, because you're not going to get a nice finish down there. And if it's on a patient, you're not going to, your composite may fail because you've got contamination down in there. So watch that you don't burnish the band too aggressively. If you're used to burnishing a Toffelmeyer band and you're aggressively trying to stretch that metal over to the adjacent tooth, you don't need to do that with a sectional. It's just a little tug. Just push it over there. If you burnish it aggressively, you're going to put lines in the band with your instrument that you're later going to have to try to get that out finishing, and that's no picnic. So the band is tender, so don't distort the band with your burnishing action. So, and then always again double check to make sure that you've got a good seal down there. So start with a fender wedge when you're prepping. It's going to protect the adjacent tooth. It's going to start the separation process if you're working on a live patient. Then band. You pick a band that most closely approximates the height of the tooth, and then hold that band in place with your finger while you're wedging. Wedge from the side that the restoration tends towards. In fact, this is a really good example here. You see, this one is quite wide. Let me grab another band, and I'll show you why we want to wedge from the lingual on this one. Oh, I got like 3 bands there. There we go. Yeah, the bands, yeah, I do have actually 3 bands. They will stick together a little bit. Not actually stick, but just they're so thin, they kind of, the cohesiveness between them is sometimes make them stick together. So if you take them and just drop them on your tray, they will separate, and that way you make sure you're not trying to place multiple matrix bands in there. So there we go. We've got that in place. I'm going to grab another orange wedge here. So wedging it from the lingual on this one, you can see how this wider part of the wedge, I don't know if I can get any closer there, the wider part of the wedge is supporting that band nicely in there. So that's why you want to wedge it from the side that the restoration tends towards. If I flip this wedge around, get it in from the other side, the skinny little tip isn't doing much to, on this lingual corner of the box, it's not doing much to seal the bottom there against the tooth, where if I had it flipped around, the wider part would seal that better. So that's why we do it that way. So once your restoration is complete, you're just going to walk back the process. Remove the ring, Pull out the wedge, and it's a good idea, even though these are non-stick, if you use an Explorer or something and pull these ends back on the band to make sure they're not bonded or there's any adhesion to the tooth surface whatsoever before getting a nice big bite on it with like a mosquito hemostat works really well. Sometimes a cotton forceps, this is a surgical tissue forceps, so it's got a little better bite, but sometimes cotton pliers, cotton forceps don't have enough grip on them to remove a band, so you may want to just have a hemostat handy to grab that band out of there. So, all right, so let's flip to the next slide here. So I want to open it up to any questions that you might have at this time. If you have any questions, please go ahead and type them in, and we'll answer them here in a minute. If later on you happen to think of any, something that you'd like to see covered in a little bit more detail, please feel free to send me an email. I'm more than happy to jump on the phone with you, or we can set up one of these little sessions like this at a time that's convenient for you. So